Between C7 and T1, what's the name of a nerve that exits?
C7.
T1, yeah. The name of a nerve that exits.
C8.
C8 nerve, what's the name of it?
C8.
So between C8 and T1 becomes what nerve? Some will know it. Caroline will probably know. Come on.
What nerve
Yeah, what
between?
nerve? The name of a nerve. Ulnar nerve. Good. Well done. So the ulnar nerve. Okay. So the ulnar nerve. C8. Okay, if you're not sure, C8. You think it was C8? 8 cervical nerves, 7 cervical vertebrae. All right. So 8 nerves, 7 bones. Okay. Because you've got C1 above. Okay. And then it changes because C7 nerve is above the level, whereas T1 nerve is below the level. Because T1, T2, the nerve of T1 is below it. Whereas C6, C7 nerves above it. If that makes sense. The ulnar nerve, there's a tunnel in the hand, but the ulnar nerve can get caught. What's the tunnel called? It's too easy.
Guillain.
The Guillain tunnel. Where's that one? This is just quick, briefly. What did you say just there? Where?
Between the pisiform and
Yeah, between the pisiform and the hook of hamate. There's a tunnel of Guillain, the Guillain canal. Yeah, where the ulnar nerve will come through. So the person might have tingling to the where? The little finger. So the patient comes in with tingling to the little finger. Obviously the chiropractor is going to start here. Yeah, whereas maybe the sports massage therapist might start here. Because they might look at maybe what's causing it in here. Because it could be a hand problem. Yeah, tunnel of Guillain. Who will suffer with this? Cyclist, good. Because it's called a cyclist palsy. Of the ulnar nerve because of the position of the hand in racing. Now, also around the elbow. Yeah, the epicondyle, the medial, so the ulnar nerve will show itself here. So you might also get an issue in this area. Okay, ladies, you might find the angle. What's that angle called here? Like on the knee, obviously this is the Q angle of the quadricep. What's the angle called here? This angle. And ladies, you have is increased.
Is it carrying angle?
Well done.
Yeah.
It's called the carrying angle. Okay, because because you have a hip. Men are pretty straight. Obviously, the arm's clear when you're carrying your shopping bags. Okay. It's true. The carrying angle.
Because men don't carry shopping bags.
Is that? Thank you.
they carry every single one at the same time.
Yes. Yeah, we carry them all. One go.
25.
Yeah, but it's true because women you might be more prone to having this sort of symptom because of the cubital valgus angle. Yeah, cubital elbow angle here. So that nerve is naturally more tethered because of the position anatomically. Yeah, because of the hip. Yeah, the clearance for the hip. Okay, so bear in mind it could be coming from a few structures. So we might as well start. Also, when we look at end range, so let's say what's the normal range of motion for C-spine in degrees? 80. Okay, so 80 degrees. Okay, where's the first 50% of a motion, which is 40 degrees, tends to occur from where? What two levels? C1 and C2. Okay, so C1 and C2. Yeah, the rotation, half the rotation is coming from C1 on C2, and the rest of it, the other 50% or 40 degrees is coming from C2 to 3 to 3 to 4, down to T3. So C7, T1 is fixated, then that's not working, then the joint above, C6 and 5 and 4, will compensate for that. So you might find these joints become degenerative. So if you come to see me with a C4 5 problem, disc, I might leave it alone and treat below it and treat above it. So I take the pressure off it, okay, rather than manipulating the problem, because it's not really the problem, it's the symptoms, and the problem might be below or above. Come back a little bit, please. Now, when I watch people do this one, there's nothing wrong, but they mess about, or fingers behind your neck, they do this, okay, and then what they do then, they mess about trying to put the arms, and then come in, over, okay, it takes a lot of effort, etc. Then from here, then they can manipulate. Then all people also use the shoulder too much, okay? They use the shoulder to manipulate, leave it alone. Because you've got a problem with your shoulder, like AC joints or more dislocation of the shoulder, they won't like it. So let me show you the way I do it. And also top, keep on, so the arm come under the armpit. So keep the tops on, so from here, so my hands come through onto their forearm. And I say to my patient, interlock your fingers behind your neck. Interlock your fingers, so I'm already there, yeah? Okay, and then from there, I close the elbows down to protect the shoulders. From here, I can vary this depending on how much flexion we've got to extension. All right, so we can maybe target C7, T1, but we could add in a bit of flexion to get to T1, T2 area here. Now, Again, men is a little easier because I can put my upper chest onto her upper back here. So I'm going to flex my patient and I'm going to extend. It already went click. That would be the perfect scenario in some ways, even though that click can be what we call a pre-click. It's like a ligament flicking over. So we flex, can we see? I extend, see that? So I flex and extend. I'm on my back leg rather than being both legs arching my back. So I'm trying to pivot forward, backward. So this is the mobilizing, if you want to call it that, even though it's already cavitated. Take a breath in. And on the out breath, try to relax. Lock. First. Relax. Good? You okay?
Yep. Great.
Okay, so that was a C7. Now the continuation is the movement. A lot of people, they don't think about the movement, okay? So you flex and it's just a continuation of the movement. So you feel the bind and it's a thrust from the bind, but try not to allow them to extend. So you almost want to keep them in flexion. So you keep them in flexion as you lift and then you thrust. Watch again. Hands onto the mid forearm, interlock your fingers. From here, I close the elbows. If you're able to, I put my upper chest over upper back, so I'll lock her in. You can use a towel if you want to, if you feel it easier. So from here, so I'm flexing, and then I'm not really extending, because it's still in relative flexion here. Even though I'm extending, the spine is still in flexion here. So from there's the lock, okay, so the continuation is the lock, and it's a continuation of that movement. It's not going to go again, because it's already cavitated.
What are you doing with your hands? Are you pushing on her?
I'm using equal pressure on my arms to do that movement, so almost like
So there's
from there.
nothing going that way? You're not doing
No,
extending
no,
your
no.
arms?
I know
you're-
people
you're-
do that with their hands on the neck sometimes, but I don't.
Okay.
So show it without her. What movement do you
So
do?
I'm using my chest to lock, and it's more of a lock.
Mhm.
That movement. So I'm using my chest to. Yeah, that's why I might use a towel potentially for the ladies. Yeah, on here. But there are other ways, like in my other course, I'm showing prone. Yeah, that sort of thing. In fact, a friend of mine, I've got no idea how he does it. The patient is sitting, and he uses this on T1, this on C7, and he literally comes over the patient, locks in like that, and then he locks, and I think that's just fantastic. Yeah, I can't do it. Okay. I've tried, but then he can't do it for some ones I do, so he works in swings and roundabouts. So he comes in, locks right over, and right in, but no. Okay, pretty cool. Now this one's a lot safer because we're not really using the neck to do the movement. If we are doing a prone one,
Yeah, it's
that
horrible,
one,
yeah.
okay, then obviously the neck is involved now, then we are using the thrust with
You
the thumb.
like that one?
It depends on the patient. If you've got a degenerative neck, I'll leave it alone.
that's
Because the
right.
neck
Technique.
restricts the movement. Okay, so if you just watch again, so the patient sits back from there, yeah. Hand, forearms, interlock your fingers behind your neck. Interlock your fingers, good. Elbows closed so you protect the shoulder. Upper chest, couch a little bit lower. So from here, lock, flex, lock, thrust. So can you see it's a continuation?
Does you feel that you feeling a lock then?
Of course,
Oh,
I wouldn't do
God,
it. Yeah.
Can I just ask, do you go above C7? Are you
No.
particular about that?
No, you won't go above C7 this one.
No, I mean like with my hands. Are you
Oh, your hands are
focusing
above
where-
C7, yes. Yeah, so you interlock your fingers.
Okay.
Yeah, so, yeah.